Hello, my Red Tribe, and welcome to Dr. Red Diaries. On today's episode, we'll be talking about something that is very important. It's going to be like a mini series, but we're going to start it today. So it's about the hidden cause of falling sick in Nigeria. So for this series, we'll be talking about how expensive and costly it can be to really fall sick in Nigeria. We're talking about HMO, health insurance, the pros and the cons, but today we'll be having like an introductory phase. So let's just get right into it. In Nigeria, falling sick doesn't just affect your body. It affects your wallet, it affects your peace of mind, it affects so many other things. And sometimes it even affects your faith, if we're going to be honest. I've had patients that when they come in, for example, during my years of clinical practice, one of the first questions they will ask is, if I tell them go and do this test, or go and buy this medication, or go and do this or do that, one of the first questions they ask is, doctor, how much will it cost? Because they have to calculate and check their pockets before they make any form of payment. And another thing again in Nigeria is that over 90% of Nigerians do out-of-pocket payments. Out-of-pocket payment simply means that they pay on their own. They don't have they can't take loans. They don't have any HMO or health insurance cover. And because of this issue, because of this challenge, because of fear of bills, fear of being turned away from the hospital, fear of surviving the sickness, but losing every single thing else. I've had people that have taken loans or even sold all their properties just to take care of either a loved one or to take care of a long-term or a chronic illness. And it's a major challenge, especially in Nigeria, with the fact that we have, I would say 80% of the Nigerian population living below poverty line. You can imagine that percentage. And most of those people within that range are the ones that tend to fall sick the most. Why? Because they don't have access to either good water, good food, good environment, good lifestyle, or healthy lifestyle. So they are prone to a host of diseases and a host of medical illnesses. So you can imagine those sets of people having to pay for healthcare. So now let's start with money. Now let's even talk about that. Because in this country, healthcare now is not just about healing, but it's about affordability. Can I afford to go to the hospital? That's the reason why we also have, in Nigeria, we also have a lot of people that do self-medication. I will always say, before somebody messages me via WhatsApp or even calls me on the phone and have a medical complaint, they would have bought medication. They would have visited maybe a chemist, a local pharmacy, or a big pharmacy to have bought one medication. They would have self-medicated once or twice or even 3 times for that particular illness before they remember that, oh, okay, let me even message the doctor that I know or the nurse or whoever it is just to seek consult or medical advice. Why? Because they will think about it, the cost of, number one, going to the hospital, aside from the long wait, but even you pay for registration, you pay for card, you pay to see the doctor, you do a lot of tests, you do so many things. You've run into sometimes unnecessary debts that you are not planning for, you did not plan for. And I've seen patients over the years delay their treatment for weeks because they were looking for money. I've had the opportunity, when I had the opportunity to work in a primary health center in Lagos, this was like maybe 5 years ago or so. And over 5 years ago, maybe 5-6 years ago. And the woman, she was pregnant. She already had like 3 children, as in within the space age of maybe few months, 9 months, 1 year, like that. And she was pregnant for like the 4th time. And for the primary health center where 6 years ago, it was really, really affordable. I'm saying you are running maybe simple tests for 500 naira. She could not afford, she could not pay 500 naira. She could not. It was I told her, okay, go and do this test. She asked me how much. I told her 500 naira. It's not even my job to even know the price of these things, but because of the fact that I have worked in some remote community centers, I try to really understand and know prices of these things so that when my patient asks me, I can be able to tell them. I told her 500 naira. And she looked at me, she was like, she does not have 500 naira. Me looking at her alone, I knew she did not have 500 naira. But I thought it would be like, okay, 500 naira. How come woman with 3 children did not have 500 naira? And when she was saying she didn't have it, guess what? I looked at her children. Some of them were holding sweets. They're holding sweets and holding interesting things. I told her, I said, but you use money to buy sweets for them. And then she said, oh, it was her husband that bought the sweets for them. But I'm like, okay, talk to your husband to provide the 500 naira. But that's even a different conversation entirely. During this ministries I'm going to talk about the toll of healthcare or a medical condition, with how a loved one actually deal with it, because it's actually a very, very important topic. And she was not able to afford the test, but I had to run the test for her for free. Why? Because she was pregnant. It was a pregnancy test I wanted to do for her. She was heavily pregnant, whether pregnancy test or urine test, I can't really remember which. But she was heavily pregnant and I needed to run a test for her because her blood pressure was high. I think it was a urine analysis I wanted to do for her, but she could not afford it. She had to think twice for her to be able to pay for the test. What can we do actually as Nigerians? What can we do? One of the things I think we need is community health-based health insurance. It's something that I've thought about before. I'm not referring to corporate health insurance, but that's one of the most common things that we have in Nigeria. And I'll talk about that in another episode. But I think we need community-based health insurance, like local cooperative churches and even market association doing like pooling of funds for maybe the association or for the church group, and then they pay for health insurance plans for their members. I think that would go a long way. I would take time on that episode to talk about health insurance and truly why I feel it's very, very important and the benefits. In Nigeria, for example, we have only 5%. I think 5% now, 6% of people that have health insurance coverage. And there are several reasons for that, either because of beliefs or because they don't even, and one of the major challenges is that they don't understand how health insurance work. And if they really understand, they would see the benefit and they would get more people to really want to buy a plan for health insurance. So I think doing a cooperative, a community-based health insurance plan would actually work, would actually help a lot of people. And I think we need to have more health loans, a more organized one anyways, either from these health insurance companies or from some other micro health companies or any health company in general that can really provide some good health loans for Nigerians so they can be able to come in and put things together. If you've noticed, I've not talked about the government. Why? Because the government on its own has its own health insurance scheme, which is called the National Health Insurance Authority, which I will talk about some other time. And we have a good number of people that are under that plan. That's also another good advantage that I think people can benefit from to really relieve the stress of making so much payments for healthcare. All right. So what are some of the things we can also work on that can even provide some form of change? I think number one is that let's try and start normalizing community. I'll talk about a lot of community because I think community-based projects or community-based campaign is going to be very, very effective, especially in Nigeria, because in Nigeria, we have a lot of community and we do a lot of things in commune. I don't know if you understand what I'm saying, but yes, it will really help us a lot. So let's normalize community mental health support, counseling units in local primary health centers. I think when I was working in a health center, I had that running for some years before I left the health center. I was running a primary health community counseling units, and it's really helped a lot. I know a lot of people that we're able to counsel and even diagnose with some mental health conditions, and we're able to refer to tertiary institutions. So I think that would really help a lot to really reduce and alleviate the expensive burden and costs of healthcare for a lot of Nigerians. And also we need like patient support groups for mothers of preterm babies, people living with hypertension, with diabetes, people that survived cancer, for example. And just the idea is to, and something that we don't really have a lot in Nigeria, and I think it will be very helpful. The idea is to come together and encourage one another, because those are things that are very expensive, that are more like luxury actually in Nigeria, but we can have them in communities, in primary health center. So I think it's going to actually go a long way. Now, finally, let's talk about the biggest cost. That's the system itself. You know, at the moment, our hospitals are underfunded. Our health workers are underpaid, and many of our brightest doctors, if whether we like it or not, are leaving the country. Jackpot syndrome. And it's hard to really heal a nation, for example, when the healer itself is tired. I think yesterday first, I read the post about when I think the doctors are currently on strike, and I read the post where they were comparing the fact that how can a doctor that is underpaid, having brain drain, dealing with so much, now take care of the sick taking care of the sick, or the blind leading the blind. It is definitely difficult. I've seen doctors working 48-hour shift, or even health practitioners, even nurses and the rest working longer shifts, 72-hour shift. This is something that even me I've done before. I've done a 72-hour shift, and I can tell you for a fact that I broke down afterwards. And we've seen a lot of doctors like that, and healthcare practitioners lose themselves, lose their lives because of that brain drain and because of that stress. I think we can really, number one, strengthen our national health insurance scheme, which I spoke about before. Make it easy, make it accessible for people. We can build public and private partnerships with companies, and even with private HMOs, for example, that would provide micro health insurance scheme for Nigerians so they can be able to access care. And I think we can reward and retain healthcare workers with better pay, better housing, and career support. That's what I think actually, because I think not everybody has the mental capacity and ability to withstand every challenge or issues that gets thrown to them. The truth is, every time a Nigerian falls sick, and every time a Nigerian goes to the hospital and they are not able to access care, one, or they go and then they ask for how much it is to run this test, and because when they hear the price, they have to turn back. I think it shows the weakness of our nation, and it's not even our strength. And it's something that we really need to come together again as a community to actually work on. We've seen mothers who would sell everything to save a child. We've seen nurses who would show up again and again and again after sleepless hours and days of night shifts. And the patient who is trying to fight to recover with faith and with grit, just to still try and deal with the expensive cost of healthcare. So the truth is, real change will happen overnight, but it can begin with awareness, which we're having right now, and with a lot of advocacy. I really want to do a lot of advocacy for a healthcare system, for the Nigerian healthcare system, especially with our communities. And also, with this advocacy and awareness, we're able to demand more accountability from even the government, or even our local councillors or local chairmen in some local governments, that will really help improve the healthcare system. The truth is, if we can improve our community healthcare system, then we can be able to expand that into the secondary and even the tertiary healthcare system, and even to the private hospitals and the healthcare system. Because the truth is, healthcare should not be a privilege. But the sad reality is that it's a privilege in Nigeria. It's a luxury for you to be able to afford healthcare. It is a luxury, but it should not be. It should be easily affordable. It should be easily accessible. It should be seamless. It should be something that every Nigerian at least should have access to. And for us to come together to make it work. So like I said, I'll be sharing a series and I'll be talking more about this. It's just an introductory episode on this topic because it's a very important topic to me. And I know it's a very important topic to everyone. So I'll see you again in my next episode. Thank you.